Association UK. Doctor, thank you for joining us. You heard our reporter there. You work on the front lines. Just describe for us what it's like going to work every day for you and your colleagues.
It's a very grave situation, and in many ways I think the situation is deteriorating, and it is really, really important that people listen to the public health advice. Just this week in my own region, the West Midlands, we're reporting that we could potentially run out of critical care beds in 2 weeks. So it is vital that people pay attention. I'm fed up of some of the idiots you'll see in some of the videos outside St Thomas's Hospital, but we've had people in our own region breaking into hospitals and actually just getting in the way of the hospital functioning. COVID-19 is a very serious condition. Earlier this week, a friend of mine, in fact, a colleague of mine, died of it, and so I'm get fed up with dealing with these COVID idiots, as they get called.
Yeah, I want to talk about them in a moment, but just with your colleague, was he or she a doctor? And certainly that must ricochet throughout the community to have to lose someone.
Oh, absolutely. Donal O'Donoghue was one of the most senior physicians in the country, registrar of the Royal College of Physicians, 64 years old. I became aware that he was ill just before Christmas on ITU. In fact, I ended up having a bit of a rant because I was going to fill up my car with petrol, and I was the only person at the petrol station wearing a mask. I think that, we are going to get through this together, but we need to get through this together as a community. And I think some of the issues is that we're talking, people in Birmingham, England aren't going to be so bothered by what's happening in Birmingham, Alabama. And actually, it's really, really important that the story of COVID-19 comes from healthcare professionals, such as people at Doctors Association UK, but also nursing staff and others, that people just realise the gravity of this condition and where we're heading, which is not a pretty place.
You talk about your frustration of people who believe this is a hoax, and that you say they also sort of get in the way or come into the hospitals. Just talk us more about that, and why don't you think people are getting the severity of this now, well, I think after all these deaths?
Absolutely, and I think it's interesting. I think the numbers don't help. Actually, just imagining in the UK the same number of people as you would see in the Olympic Stadium in London, that's how many people have died. People have become numb to the numbers, and I don't think it helps. And understanding these are real people, your neighbours, your friends, your colleagues. And I think it's difficult because obviously some people can be asymptomatic and can spread. And only yesterday I was speaking to one of our secretaries, her family, a couple of months ago, 12 people have become infected before they became aware. So it's these kind of challenges, and it's really vital that, on the one hand, people stay at home, but also if they have a medical problem, they contact a doctor, and we will see you by video or phone or some other way of doing it, contacting 111. So these are real challenges, but it's not just the Billy No Mates on social media. It's also some of the mainstream commentators I think have been unhelpful. In a day we're hearing about Trump being banned from Twitter. It's also some of the correspondents saying the Lockdown Skeptics website, this kind of thing, which are really unhelpful.
What are you dealing with in terms of the direct implications of this virus on the body, particularly when it comes to incidents of strokes and clots? What do you want to know about how this virus attacks the human being, the human body?
That's an extremely good question, because actually I think it's there's been too much of the focus has been on ITU and respiratory, as if it's just a lung disease, when actually it's a multi-system disease. I'm a neurologist, so it causes stroke, it causes blood clots. My renal colleagues are dialysing, half the patients they're seeing that are being dialysed have COVID-19. So it affects every specialty. In some senses, I would say that every doctor in the NHS is a COVID doctor on some level.
And how are you feeling now? Do you feel like there is light at the end of the tunnel?
It is fantastic news about the vaccines, but we have to follow the public health measures. And I almost think of the first wave, I felt we were like the blindfolded woman on the train tracks with the train coming. This time we have the blindfold off, and we don't know how many carriages are on the train.
Consulting neurologist Dr. David Nicholl, thank you very much for your insight, all your hard work. Good luck. Appreciate you joining us and sharing your message.
Thank you.
Well, 81-year-old Stefano Bozzini of Italy became an internet sensation in November.